His name was Harold. He was 88 years old, Vietnam veteran, Purple Heart recipient. He lived in a nursing home on the west side of town where the rooms smelled like disinfectant, and the staff did their best with too many patients and not enough hands. On March 14th, 2026, at 6:42 in the evening, Harold had a massive stroke in the dining hall. The nurse on duty called 911 immediately. She gave them the address. She described his symptoms. She said they needed an ambulance right now. Medicare Advantage denied the transport. Harold died on the floor 47 minutes later, while the 911 operator stayed on speaker, begging the insurance company to approve the ambulance. Harold had served 2 tours in Vietnam. He came home in 1969 with a medal he never talked about and memories that woke him up at night for the next 50 years. He worked as a mechanic. He married his high school sweetheart. They had 3 children. His wife died in 2021. After that, Harold started forgetting things. Small things at first, where he put his keys, what day it was. Then bigger things, his children's names sometimes, how to get home from the grocery store. The doctor said it was dementia. His kids tried to take care of him at home, but he needed more help than they could give while working full-time jobs. They found a nursing home that accepted Medicare. It wasn't fancy, but the staff seemed kind. Harold moved in during the summer of 2025. He'd been there 8 months when the stroke happened. It was a Tuesday. Dinner was at 6:30 like always, meatloaf and mashed potatoes. Harold was sitting at his usual table with 3 other residents. The nurse who was working that evening said he'd been fine all day. Alert, talking. He'd walked to the dining hall on his own. Then at 6:42, he stopped responding mid-sentence. His face drooped on the left side. His left arm went limp. He slumped forward. The nurse reached him in seconds. She checked his pulse. She called his name. She recognized immediately what was happening. Stroke. Every second counts with a stroke. She ran to the nurse's station and called 911. 6:43. The dispatcher answered. The nurse gave all the information. Patient name, age, symptoms, address. Unresponsive left-sided facial droop, left arm weakness, sudden onset. Classic stroke presentation. The dispatcher said an ambulance was on the way. Then he asked a question that would kill Harold. What insurance does the patient have? The nurse gave them the Medicare Advantage plan information. The dispatcher said he needed to verify coverage for transport. The nurse said this was an emergency. The dispatcher said he understood, but protocol required insurance verification for nursing home transports. 6:48. A representative from the Medicare Advantage company came on the line. The nurse could hear her through the speakerphone. The representative asked for the policy number. The nurse gave it. The representative asked for the patient's date of birth. The nurse gave it. The representative said she was pulling up the account. Harold was still on the floor. Other residents were being moved to different tables. One woman was crying. A man in a wheelchair kept asking what was wrong. The nurse kept the phone on speaker so she could stay with Harold and monitor his breathing. 6:51. The insurance representative came back on the line. Ambulance transport is not pre-authorized for this facility. The nurse said it was a stroke. The representative said the plan required prior authorization for non-emergency transport from skilled nursing facilities. The nurse said this was an emergency. The representative said emergency determination had to be made by their medical review team. The nurse asked how long that would take. The representative said usually 24 to 48 hours. The nurse started yelling. This was a stroke. They had minutes, not hours. Brain cells were dying. The representative said she understood, but policy required authorization. She suggested the facility transport the patient themselves or arrange alternative transportation. 7:02. The nursing home administrator had been called. She came to the dining hall. The 911 dispatcher was still on the line. The administrator got on the phone. She explained she could not legally transport a patient having a stroke in a facility vehicle. The liability was too high. She needed an ambulance. The dispatcher said he understood, but the insurance company had to approve it. He'd been calling his supervisor. He'd been trying to get through to someone else at the insurance company. He asked them to please keep holding. 7:15. Harold's breathing changed. It became irregular, loud. The medical term is agonal breathing. It means the brain is not getting enough oxygen. The nurse knew what it meant. She begged the dispatcher to send the ambulance anyway. The dispatcher said he couldn't without authorization. His hands were tied. If he sent an ambulance without insurance approval, the nursing home would be billed directly. $14,000. The administrator said the facility couldn't pay that. They were barely breaking, even as it was. Most of their patients were on Medicaid. They didn't have $14,000 for an unauthorized transport. 7:29. The 911 supervisor got on the phone. She started demanding to speak to someone with authority at the insurance company. She was transferred. She waited on hold. She was transferred again. Finally, someone who said they could make an exception got on the line. The supervisor explained the situation. 88-year-old stroke patient, on the floor for 47 minutes. Breathing deteriorating. They needed authorization immediately. The insurance representative said she would expedite the review. 7:31. Authorization approved. The dispatcher immediately sent the ambulance. They were 12 minutes away. 7:35. Harold stopped breathing. The nurse started CPR. She did chest compressions. She gave rescue breaths. She kept going until the ambulance arrived. 7:39. Paramedics took over. They intubated Harold. They got him on a gurney. They loaded him into the ambulance. 7:42. One of the paramedics came back inside. He told the nurse they'd done everything they could. Harold was pronounced dead. Time of death, 7:29. The moment the insurance finally approved the transport. 28 residents witnessed Harold die on the dining hall floor. Most of them had dementia. They didn't fully understand what they were seeing. But some of them did. They knew. They watched a man die while people on a phone decided whether his life was worth $14,000. The nursing home brought in a counselor for the staff. 3 nurses quit within a week. The administrator reported the incident to the state health department. An investigation was opened. 6 months later, the report concluded that the nursing home followed proper protocols. The insurance company released a statement saying they regret the outcome and have reviewed their authorization procedures. This is not an isolated incident. Nursing homes across the country are dealing with prior authorization requirements for emergency transport. Residents having strokes, heart attacks, severe bleeding, respiratory failure are being subjected to insurance verification while they deteriorate. Ambulances are being delayed or denied while medical review teams decide if the emergency is real. Facilities are caught between legal liability for transporting critical patients themselves and insurance companies that won't approve professional medical transport. Harold served his country. He worked for 43 years. He paid into Medicare his entire working life. And when he had a stroke, the system he paid for made him wait 47 minutes on a floor while bureaucrats verified his coverage. By the time they decided his stroke was worth treating, his brain had been without adequate oxygen for 3/4 of an hour. Even if the ambulance had arrived sooner after approval, the damage was done. The window for stroke treatment is measured in minutes. Harold lost 47 of them. If your parent, your grandparent, your loved one is in a nursing home or assisted living facility, you need to know this is happening. Emergency transport is being subjected to prior authorization. Insurance companies are requiring verification before sending ambulances to skilled nursing facilities. People are dying while waiting for approval. Families need to ask what the facility's protocol is for emergency transport. They need to know if their loved one's insurance requires prior authorization for ambulances. They need to know what happens if authorization is denied. These stories need to be documented. Every emergency transport denial, every delayed ambulance, every patient who died waiting for insurance approval, every 911 call that lasted longer than the response time because of authorization requirements. Share these experiences, make them visible. Demand accountability. Complete anonymity guaranteed. Just the facts of what happened. This will continue until the cost of letting people die on nursing home floors exceeds the cost of sending ambulances without prior authorization. Right now, someone else is having a stroke in a care facility. Someone else's nurse is calling 911. Someone else is waiting while insurance companies verify coverage. This is the reality of prior authorization in emergency care. This is what happens when even strokes require approval. Right now, in some nursing home across America, another veteran is lying on the floor having a stroke, and someone is on hold waiting for UnitedHealthcare to decide if he's worth saving. Subscribe, because tomorrow it could be your father, and 47 minutes will be eternity.